Hello, everybody. Welcome to another fantastic presentation from our interns here at El Terreno. My name is Joshua. I'm the founder and director of El Terreno Cultural Exchange Center here in the Ecuadorian Andes. It's great to have you all with us. So we have another internship final presentation, this time from Louisa, Laure, and Adie, who've been with us this summer, doing a really interesting project looking at reproductive health, which is a really, really important topic here in this region, as you will soon be finding out. And I've been really pleased and impressed to see the progress that they've made and the potential results that are coming out, especially from the conversation that we had yesterday at the health center. So without any more, I will pass over to Adie to begin with your presentation. Take it away, guys.
Okay, perfect. Thank you. So, hello everybody to join our presentation. We are a group of 3 women who done a deeper dive into the gender equality internship. And we done like the health reproductive part of it. So my name is Luisa. I'm from Germany, and I'm a nurse. And at the moment, I'm studying psychology, and I joined the project for 1 month. You need to turn your, yeah.
My name is Adie. I'm from Australia, and I'm currently on a gap year. Doing volunteering abroad, and I wanted to come to El Terreno because I thought it was an opportunity to realize a project of my own, gain some new skills and make a meaningful impact in the community.
My name is Laure. I'm French. I studied Spanish, and next year I'm going to do a master. And está bien.
Yeah, and we would say a special thank to Pamela, who was she was our project mentor, and she helped us with the whole project and the whole process. And she done a really fantastic job, and we are really glad that she was our mentor, and also like the healthcare center of San Juan, especially Andres and Sebastian, and also Julia, who done the first series with us in the schools and helped us out. And yeah, just made it happen that we can go to the schools and done our project so far. So we are like in the group of the Gender Equality Project, and this summer there were like 2 other groups, and we are like we were splitting in 3 parts. The first part was like culture part, where they done a documentary about the life of the women here in this area, and then the other part was like more researching education part, and was like the Pasos Futuros. This was also really, really interesting, and we are like the third part of it, and our part was more related to the healthcare system and especially the reproductive health.
So in our presentation today, we want to go through our methodology, first of all, the process that we went through during our internship. And then we'll go through the first step, which was understanding the problem, talking to the communities, what we found out from that in terms of the problems that were faced, and then our proposed solutions, and at the end there's an opportunity for any questions that people might have. So in terms of our methodology, Like many of the internships at El Terreno, we're using the design thinking methodology, which has 5 steps. The first step is to do with empathizing. It's about going into the community, meeting the local people and understanding the issues that they face without forming like pre-assumptions about their context. Second part is about defining, so pinpointing exactly who the audience is, who we're trying to target, and then what our key problem is, and framing a question about that we can try to solve. The third part is the ideation stage. So that's about coming up with as many ideas as we can, and then really fleshing out their concepts, and prioritizing the ideas we have according to effectiveness, according to achievability, and then choosing our favorite ideas. From there, we go to prototype. So we create a pilot project, and then we test that and use that feedback to evaluate. So for our project, we actually had 2 ideate prototype test stages. The first one was from Louisa's project and the first workshop series and the resources she created. And then when Laure and I came, we did a second stage where we ideated, prototyped, and tested our second solution.
So at the beginning, we done the empathize, and we just at the beginning met the community, done a tour of the local community just to have like overview how it looks like, how the people are living there, how the healthcare system is working. We just met the people from the healthcare center and done some discussing with the local doctors just to have a look how they work and how the people deal with their health in this community. And also like we met some people from the Plan International who doing a great job in this community, and also they have some really nice projects with the pregnant women here in this area, and they do like a farming project that they have like fresh food. We also met them, and also went to some meetings with the pregnant women's and to see how issues they have at the moment and what they need. And then there was also like other really interesting meeting from the whole community in San Juan. This was like indigenous midwife meeting. We also joined them just to have a look, how do they get birth and what other type of what other type of birthing they have here. And yeah, also we collected data from the healthcare center. They have a lot of data, and we just had like an overview how many women are pregnant, in what age, how many teenage pregnancy do we have here in this community, who are the youngest, who are the oldest, which are the high-risk pregnancies, and where do they live. And then we define, and our central problem was like the high rates of teenage pregnancy. It's like over 25% in San Juan, the Luyundongo and neighboring communities. And so we thought maybe our focus could be on the younger aged teenagers, or on the teenagers between the age of 13 and 16. So it was like from the grade of 8 to the grade of 10. We went to the school and to the surroundings. So when I done the first workshops, I went to two different schools just to do the pilot project with them. And our problem statement was like, how can we educate teenagers on sexual health, contraception, violence prevention, and empowerment to help them make better informed life choices? Yeah.
So from this stage, we had a number of key findings, but we were able to put them into 3 categories. So the key problems that we found related to the high rates of teenage pregnancy were to do with the lack of knowledge, lack of support, and lack of resources, which I'll go into detail in the coming slides. So in terms of the lack of knowledge, this came because the young teenagers have very little means to acquire information about like sexual health. So for a start, there's a lack of educational programs. It doesn't seem to be in the curriculum of the schools, and because of because it's a taboo topic, there's a lack of discussion with adults, with their parents, with their families, and if there is any discussion, then it tends to be with their friend groups who also don't have the information to answer their questions. And they have a poor capacity to obtain further information because very few of the girls have their own phones, their own technology, and they don't tend to use websites. So it would have to come from social media. And because of this lack of knowledge, when we were doing the initial testing as part of the workshops, we found that, for example, with puberty, there was a lack of knowledge about the key sexual changes that occur. Often the students would just be able to name one body change during puberty, but not understand the whole context. For example, with contraceptives, almost all the students knew what a condom was, but apart from that, the other contraceptive methods were not very well known. None of the students knew what an STI is, and in terms of violence, they were not very able to recognize the different types of violence. Only 40% knew what physical violence was, 30% psychological, and 20% sexual violence. In terms of the lack of support, what we found was because it's a taboo theme, there was a shame about discussing sex, both with family, as I've discussed, but also with medical professionals. And this is also compounded by the fact that in many of the communities that's served by the San Juan Medical Center, there's a long distance to get there. So that creates a barrier for many for getting their questions answered or seeking help. And then the other issue with lack of support is that there's poor institutional support in cases of violence and abuse. So women and girls who are suffering from this don't have many places to go. And on the right, there's a graphic about from our questionnaires, we asked to what extent can you speak to someone about sex or sexuality from 1 to 5. And the responses were not very good, in particular for the 10th grade. Like almost half of them said that they can't speak to anyone about this topic. And then going on to the lack of resources, this we also found from the questionnaire at the end of the first workshop series, that while most of the students, or almost all the students, wanted to use protection, they weren't able to access the means to protect themselves. And while the San Juan Health Center does have contraceptives available, because of the barriers I spoke about, the shame and the distance, they don't feel that they're fully able to access the means to protect themselves. And then also for the girls, almost a third of or more than a third of the girls were unable to access what they need during their periods.
So we just tried to find some solutions of it. And yeah, there we have also short overview about our workshops. And then we also we want to start a WhatsApp communication line. And then we also talk a little bit about the further steps. So at the first workshop series, I went with doctors from the medical healthcare center to the schools and just informed the kids about really, really basic informations about the reproductive anatomy and the body changes during the puberty. And there we also saw like they have a really high lack of knowledge. As Adie said before, they can talk a little bit about maybe the changes, or they know a little bit about the anatomy, but not all of them. So we done it like step by step and just gave them some really basic informations. And then in the second workshop, we talked about contraceptives and a little bit about like healthy relationships. And it was like also really, really basic. We just talked about how do you use a condom, what is like, how do pills work, what type of other contraceptions they have at the healthcare center and how they work. And then the third workshop, it was like more into detail, because at the beginning we just gave them the basic informations, and then we went like more into the topics to show them like how it maybe also works with the hormones, and how do they can make their own decisions, what is good for them or not. And yeah, so we talked a little bit about that before, about the learnings from the first workshop series. So we done a questionnaire after the first workshop series where they filled us some questions, and it was like a Likert scale from 1 to 5, and they needed to answer, was it like beneficial for you, yes or no, and why. And then we asked a little bit about the topics we discussed with them in detail, and most of the students say to us it was like really beneficial for them. And so we were like, okay, that's good to know. So it was like they found out some new informations about their body and how they can protect themselves. So we like, okay, we need to continue on. That's really nice, and we need to scale it up. And like they have like really, really low prior knowledge. So this was also why they couldn't understand all of the parts we discussed with them, especially the anatomy part was quite hard for them because they never heard something of those parts before. And they were like, okay, we don't know how sperms are working, and what is ejaculation and stuff like this. They didn't know it before, so we needed to give them more informations about these topics, that they have more informations about it. And also like some students told us like, yeah, it was nice, but at the end we didn't heard anything anymore because it was too long for us. We just looked out of the window because it was like really nice, but it was also like a little bit boring because it was not really interactive. It was like more we were speaking and they were listening, because they were like really, really shy, and sometimes we asked them some questions, but it was like they were sometimes ashamed and they didn't answer. Sometimes I think they knew the answers, but it was like quite hard at the beginning because we didn't had like a really big trust relationship with them, and it was like the first time they saw us, and it was like the whole classroom. So for the next workshops, we thought maybe we can do it like more interactive, more playful for them. It's not that boring for them. But all in all, it was like they told us it was a good first workshop series. Yeah, and then there was like a little bit more like the further knowledge gaps outside the sexual health. So we also saw, or we also heard from people we visit in the community that they have also like a lot of people dealing there with violence, with unhealthy relationships. So we thought maybe these are also like some themes we should add to the curriculum, that they have like they can do informed decisions for their life, also for their relationships especially. And like also like I said before, they need to build more trust in us, because when you do it like the first time and it's like a really delicate topic for them, they are like shamed, or they like pretty unsure what they should ask us. But when you come like maybe second, third, and so on time into the classrooms, they know you and they maybe can trust you more, and maybe they can ask some questions they really want to know. And when they have maybe some issues, they also can come to us or to the healthcare center and just say, oh, hello, maybe I'm really unsure if I'm pregnant or not, or I have my best boyfriend, how do I deal with the contraceptions or stuff like this.
So like from these findings, from our evaluation of the first workshop series, when we had our ideation, we came up with this second workshop series, which, as we discussed, we added some more themes. So it begins with the sexual education as in the first workshop series, but more spread out so that we have more time for activities and so that we maintain engagement. So the idea is that we start with the anatomy to give them the foundations that they'll need to understand other lessons such as pregnancy. And then we go on to puberty so that they understand body changes, what's normal to expect in menstruation, all that sort of thing. Then we go through to pregnancy, STIs. Then we cover contraceptives, enabling them to make decisions about what to use, and yeah, making informed decisions. And then we added a topic on sexuality and rights, because we found that in the questionnaire, that was something that they couldn't talk about, and that they had very little prior education about. And then we went to violence in relationships. And then we have a topic on broader health, which came out of, for mental health, this came out of when we were in the communities, we found out that mental health was a really big problem, and they didn't have many resources or support networks around this. So we thought we would include a workshop so that students had basic knowledge of how to manage their mental health. There was also a workshop on hygiene, because when we were talking with the health center, they highlighted that the leading cause of people coming to the health center is parasitosis, and that's due to inadequate hygiene practices, and that could be easily combated if the students were educated in that. And then we come to our last subsection of workshops, which is about empowerment and gender roles. So this ties into the other internship in gender equality, which was about future steps and empowering women. But here we really wanted to make the students aware of what assumptions there are about gender, and really unpicking why they exist, and enabling the students to really understand them and to think critically, and then how that manifests in both work and family. And then the fourth lesson is teaching them a little bit about how to respond to that, how to like assertiveness strategies, but also practical steps to address some of these gender stereotypes and roles. In the second workshop series, each workshop comes with the whole workshop series comes with a pre and post course questionnaire, which is designed to evaluate their knowledge to begin with, as well as compare it to the end, which can really tell us the effectiveness of our whole workshop series. But apart from the knowledge questions, it also asks students about their opinions, their level of support, their access to resources, which is really important information for us to gather. The workshop series also includes the lecture for the facilitators and instructions on activities, and really everything that a doctor from the healthcare center or any classroom teacher would need to run the lesson, which means that it can be self-sustaining after we've left. It also comes with student worksheets with information, so that's including kind of active listening activities like fill in the gaps, but also consolidation activities to get them to engage with the content and remember what they've learned. And then it comes with a quiz at the end of each lesson. We also were working on some further resources, which include some informative posters and a brochure with the key lessons from each of the workshops, which I'll go through in the coming slides. So this was us testing out the second workshop series on the lesson in pregnancy. And then here are the resources that we prepared. So on the left column, that's the instructions for the facilitator. In the middle, you can see the worksheets with some of the information to be completed and also some of the activities. And then we have on the right some of the tests. So the top one's one of the topic tests, and the bottom is from the pre-course questionnaire. And then here are the posters we prepared. The idea with the posters was to create something much more visual that the students can, or that we can put in the classroom so that students can see it regularly and gain a really quick base level understanding of the important concepts from each theme. And then the idea with the brochure, which is shown on the right, is to give the key points from each lecture with a bit more information, but still very condensed, so they have all the information they need in one place that they can take with them. And then this is our other project that we've been working on, which is a WhatsApp communication line for the health center. So the idea with this is that it's a WhatsApp line which can respond to concerns from the community, whether it's personal questions or it's just general questions, general curiosity about healthcare topics. And the idea is to overcome the sense of shame and provide a safe space where they can ask questions anonymously, confidentially, and really build a relationship with the staff of the healthcare center. It also allows for first-based professional support. It gives them a first point of contact if it's a minor thing or just a question out of curiosity, they don't need to travel all the way to the healthcare center just to ask for it. So it overcomes the distance barrier too. In terms of future steps, Laure will stay on for another month. So she has the opportunity to keep on developing it. The idea with the workshop series is that we have all the resources ready to distribute. So we had some really productive conversations yesterday with both different health centers to roll out in the schools in their area, as well as community groups. And yeah, we're investigating at the moment quite diverse ways to spread these resources to as many people as possible. Meanwhile, we're still piloting the workshops in the Guanta Cruz school, which is the only school who's open at the moment because of holidays. But it gives us an opportunity to test the resources that we've got and make any modifications before we publish our workshop series out to the other healthcare centres. In terms of the WhatsApp, it's currently being launched, looking to go live in the coming days, and we will be sending tests and gathering data on how well it's being used in the coming weeks. And then we've also submitted a fundraising proposal, which is asking for funds to continue the workshop series, funds to purchase contraceptives, menstrual products, all the resources that are needed. And also it's also been a joint proposal with the other gender equality project, the Puzzles Futuros. So yeah, hoping to expand all our programs, and we'll see how that goes.
Thank you for listening. And does anyone have any question?
I have a question. Can you hear me?
Yeah, we can hear you.
So congratulations on your project. It's amazing how much you've achieved. I'm curious as to, did you do the workshops and all of the work just with girls or with boys too? And what were you thinking about that?
So for the workshops, the idea is to do them with girls and boys so that they both get the information that they need to make informed decisions. The other gender equality project focused specifically on girls and creating workshops for girls. But our idea was to make sure that everyone had access to this information.
Yeah, interesting. I guess there's arguments both ways, aren't there, in terms of wanting to educate everyone, have the same messages, but also wanting people to be free to ask their questions. I don't know.
Yeah, we done it we done it at the first workshop that we just said, okay, everybody has a sheet of paper and you can write your questions down. And so nobody needs to raise his or her hand just to ask, like, I'm on my period, but my blood is a little bit brown. Is this normal or not? Because we had some questions like this. And then we can just answer them, but we don't know who was asking this question. And also, like, on some topics, you can just say, okay, this is maybe about like especially period or something like this. Boys never expect that. But we just thought maybe also it's nice for the boys to know what is a period about and stuff like this. But like the deeper questions have maybe the girls also, like how to use a condom. Maybe this is like more for the boys, but we want to inform both of them. Yeah.
Also on that, it depends a lot on the workshop. So for example, puberty is a good example. For the puberty workshop, we've designed it so that initially they start in a group together in the second workshop series to get the basic details. But then afterwards we separate them into girls and boys so that then they have a safer space to ask questions.
Yeah, Yeah, sounds like you thought of everything.
Yeah, thanks, guys. Fantastic presentation. And as was just said, you have achieved a huge amount in the short period of time that you're here, from running classes and doing funding applications and creating phone lines. You've done a huge amount, a huge amount. It's really impressive. I'm curious to know, because it's such a different context and it's a very sensitive topic. How did you find it coming here as interns and learning about the reality and the lives that that particularly young girls were facing in their day-to-day lives?
I think, I mean, I guess that's why it's part of the design thinking methodology to have like a first like 2 weeks of empathize, just to get in the community and actually understand what's going on. But yeah, it's very different hearing about it and then actually coming and seeing, going with the doctors and seeing them check up on these women who are very young and who have babies. Yeah.
Yeah, it was really special because I never had this before, or I never saw this before. Sometimes you heard about that, but you never expect like a girl coming to the healthcare center and she's pregnant by the age of 12 or something like this. But like it's also cool that we had this time just to have our pilot project and see that it was like helpful for them and beneficial. This was like really nice for me because at the beginning I was like, okay, I don't know if I can change anything about that topic because it's such a different culture and way of living. But when I saw the questionnaire and they told us, oh, it's like it's good for us and we learned, then I was like, yeah, maybe they can have a better future when we continue this kind of topics, and maybe we can't change their entire life or stuff like this, but we can maybe help them to do like more informed decisions and maybe have a kind of a better future.
I mean, I would argue that you do potentially have the chance to change lives, because one unwanted pregnancy avoided creates a whole different trajectory in life for people. So I've always seen this topic as something that's been really important. And we've touched on it before, but you guys have really taken it to another level. So I'm really appreciative of the work that you've done. From the meeting, just want to highlight the meeting that we had yesterday in the health center. We had people from, I think, 3 different health centers as well as the central city of Guaranda, the whole Ministry of Health. There were various people who were on the call. I think there's probably about 10 healthcare professionals in total present in that meeting, as well as the local nursery as well. They were asking if they could do these types of presentations to the young mothers who have kids in the nursery as well. So there's lots of interest in from local healthcare professionals, and we want to look as an organization how we can extend this work further, because it's been the first real deep dive into gender equality and this reproductive health. So my final question would be, what advice would you have to future interns who'd be coming and taking this project forward?
Yeah, just don't be shy, just do it and just try it out. And sometimes yeah, just maybe to try first to build maybe kind of a relationship with the people before, so you have like the 2 weeks before, and just go maybe to the schools, to the doctors, to the nurseries, and just give them small hello and play with the kids maybe before. And yeah, don't be shy, just try it out and you will see how it happens.
Yeah, I agree with that. I think like building relationships is really important. And like I've seen it with our pilot program, like the first 2 lessons they were like really shy, but now they've got to know us, they're actually really open, our pilot group. So yeah, just yeah, with the students, but also with the community, like building links, building relationships is really important, and spending the time to get to know the community.
Thank you. Last opportunity if anyone would like to ask a question before we close. Well, I would like to congratulate you guys one more time for a huge amount of hard work. I've seen you at 7 o'clock in the morning working on your computers. I've seen you at 7 o'clock at night working on the computers, getting up early to leave to rural communities, you know, over half an hour away driving. So lots of really hard work and dedication that you put into this. You've also worked really independently, like you've been able to take your ideas and make them a reality and take them into the world. So I really hope that this opportunity has served all of you in gaining some hands-on experience and also being able to make a difference, as you've already, you know, highlighted really clearly, in communities that really need that support. So I want to bless each and every one of you for all of your hard work and dedication, and all the best going forwards. And thank you for deciding to come here to El Terreno.
Thank you. Thank you also that you lead this kind of program, and that we have like the time and the support from you. And yeah, thank you very much. You also done a huge impact to us.
Yeah. Like, thank you for everyone who came on the call, and also thank you especially to Joshua, who made this all possible, and helped us every step along the way.
Okay, so we'll be waiting to hear about the funding application that you guys have put in, and hopefully that will allow us to take it to the next level. So watch this space, and yes, thanks for everyone else who's joined us to find out more, and wishing you all a fantastic day. Thanks very much for joining us. All the best.